questioning whether the crisis exists, I think, is misleading, and saying, you know, it might be there, it might not be there. You know, whether it's 52 million or not, whether it's a BMI of 30 or not, the problem exists. And I think a government who's questioning whether the problem exists sounds familiar for another big problem we're facing in society. It just makes me even more concerned about our current Liberal government. Second is... I've got a bit of a list. Let's just quickly try and get through them. Secondly, EU labelling of food labelling. One thing I do agree with, when the industry mounts a big response against something public health is trying to do, it's usually a sign that it's effective. The EU food industry lobbyists mounted a €1 billion response and canned the whole food labelling efforts in Europe, including the, I think, $20 or $30 million that WHO had to spend trying to get it through. $1 billion versus 20 or 30 million. Third, the solution of Ararat, they didn't change their conversation. They had 10 hours a day of exercise, and they had a dangerously low-calorie diet, which was on national television.
No.
Anyway,
That's not true.
well, you can counter it in a second. The other is around food labelling in Europe. It actually wasn't largely the olive oil industry that mounted the response against food labelling. It was Nutella that was one of the largest contributors against the response backing the Italian government, and WHO has publicly come out against, Margaret Chan, the head of WHO, has publicly come out against that. Finally, I mean, the fat tax is a great example. The fat tax, we've had an OECD report last week, we've had a WHO, world's leading technical voice on health, the United Nations technical body on health says the fat tax in Denmark did work. The fact that 85% of the population lives on islands, because Denmark is largely an island, not an archipelago that can go to Germany to buy their butter, is a nonsense that was put up by the food industry. The two largest industries in Denmark are the pork and butter industries. And what the sad part, or the good part for public health, is that when you try something and then you pull it back because the industry suddenly realises it's going to work, it's called a crossover trial. And it actually leads to very, very good quality evidence, because you can show that before you did it versus after you did it, same population, it was actually effective. WHO's come out saying pricing policies work, the tax worked. The government reviewed it and removed it, not because of anything to do with public health, but because of the industries in butter and pork in Denmark. And of course it's not going to show any change in heart disease in a year. It showed changes in consumption, but it's not going to show changes in heart disease in a year, because heart disease takes 20 or 30 years to manifest, and anyone would tell you that. Finally, and I totally agree that kids are our future, but when 1 in 4 Australians are now overweight or obese, continuing to question whether this is a problem, I think, is irresponsible. I think that, you know, we're now expecting in America, for example, there's no reason to suggest that it's not the same as Australia. It's the first generation in history that may in fact live shorter life expectancies than their parents because of the obesity crisis, which does exist. Food should be part of the curriculum, but it shouldn't be funded by a health insurance company. It should be funded by a government. Second, we should be protecting them from predatory, pernicious marketing for junk food that we know causes harm. And finally, we should be making these healthy foods affordable. We know that healthy food options cost up to 160% more. Karen O'Day and her group have done great research showing that healthy food options, the healthy basket options, cost 160% more in regional and rural Australia. That's a nonsense. It should be affordable and accessible for everyone, and not just for wealthy people living in cities.
I'm not going to rebut it all. I'm just going to talk about Ararat and the Biggest Loser, because that was just egregiously wrong. I was talking about the town. I wasn't talking about the 10 people or 20 people that went into the house. The whole town got together and has walking clubs, they have healthy eating things, they have conversations around how you do it, and it's now showed in the statistics that have come out that we're not in the top 10 anymore. So I'm not talking about the 20 people who went into the house and did all of that exercise. I'm talking about the community. And the key thing that I wanted to say about that was it was a community coming together and saying, we don't want to be fat or rat. We don't want people to say that about us. We don't want that to be true about ourselves. We want to change, and we did. We did.
I'm just going to jump in before Louise, if that's okay, and say a couple of things. One is I was at the federal health budget reading last year when they cut the preventive health budget completely, including the Healthy Together Victorian experiment and more than experiment actually, fact and success. And it was the saddest night of my career to sit there and see what was a program, because I was actually able to participate in the preventive health task force that set up that funding, and it was such a great system to encourage government, state government, local government to get behind the wellbeing and health of people. So I really feel for what you're saying there. The second thing I would add too is the concept of food. You know, it's the essential ingredient, one of probably love, and so many that we could debate this one for hours too, but there's no guidelines around food at the moment. The definition of food is what's gone wrong, and I think that's what we perhaps should debate here today, as well as what is the role of government in protecting the concept of food and what is food.
I completely agree with you in relation to health promotion, and just by way of background, I'm previously a director of the Grampians Medicare Local, and I was also a director of my local hospital board, so I saw both the preventative side and the hospital side of the consequences of it. I personally, as a candidate, convinced the previous government, state government that is, to make a promise to fund Active Ararat, which is their ongoing program to basically replace Healthy Together. And we went to the election with that as a promise. Labor has not chosen to implement that. I personally am very unhappy that Healthy Together has finished. I could see the benefits across the Grampians region, in both Ararat and in Maryborough. Maryborough has a very innovative program that goes around parenting and childhood development that's not specifically about food but does capture some of this, and that's the Go Goldfields program. But I do think that, I think if I'm going to argue that we shouldn't do the things that I think don't work, we should do something, and that is exactly what I agree with you. We should do prevention, and part of the prevention story is recognising that obesity at its high levels, so the child that was spoken about before, in the family that was spoken about before, is far more prevalent in low socioeconomic situations than it is in high, and there are a whole lot of it's not even comorbidities, although they do come with obesity. Often those people, they have low incomes, they have low life chances, their education is poor, and there's a whole lot of things wrong, and one of them is that they end up really obese. Now, we can argue how they come to be really obese and the rest of Australia largely doesn't, but the fact is that those people need some assistance in a whole lot of ways. And we should be saying, let's target our assistance at the people who need it, rather than having a general view that I think we are pretty broad brush with our assistance in a whole lot of ways, and we would be better targeting those who really need it. Maryborough Health Service has knocked together a couple of single rooms into bigger rooms that now have all the things off the ceiling that allow hoists and all that sort of thing. Others have taken different views. There is no question that there is measurable and immediate impacts on health service workers, paramedics and others, as we see this cohort of very, very large people who we have not seen before. I think think I'm overall going to disappoint you again. However, I'll start by just making the point that I am a legislator in the Victorian Parliament. I am not a lobbyist to the federal government, so I'll leave those to lobbyists to go to them. Personally, I am on the, it won't surprise you, I work for the RPA, I'm on the libertarian end, and so I am not a big supporter of regulation generally. I strongly support voluntary labelling programs, and perhaps some of the ones we see at the moment that have been very successful have been organic labelling. That is a totally voluntary system. GMO free is largely voluntary, and now halal. They're all programs that are where people have decided that they will get a marketing advantage by labelling in that way, and so personally I support voluntary labelling. I do think the original purpose of labelling, which was to be, if you said you were selling strawberry jam, it had to be strawberry jam. If you were saying that you were making a meat pie, it had to meet certain criteria, in this case, 25% meat, which can include a number of meats you probably don't think would be there, but we won't go there. So I support that sort of labelling. And in terms of the calorie labelling, I am one of the few, probably 20% of the population who looks at calorie labelling. So if I could make one change, I don't like that it's kilojoules.
I might start first. I sit on something called the Food Alliance, which is a fantastic organisation that started by Deakin and is now moving across to William Angliss, and very much talking about the food system space. And one of the first things the Food Alliance did was to map the farmable, arable land around Melbourne, so that people would be aware what's happening in Melbourne and what should be protected. But there's obviously lots of conversations going on in this space, and it's a very, very interesting one, because I think, I guess the point that I personally opened up with, and the concept of Sandro's talk as well, is how do you deal with the economic transition that needs to happen from a highly processed, highly industrialised food system that we have at the moment to one that is more supportive of local produce and natural processes wherever possible. Personally, I think that it will take government intervention to make it happen, because as we've seen, I mean, from the corporate perspective, it is about the profit first and the consequences, I guess, later. And the consequences are only felt through legislation, usually, from my perspective.
Well, I'll start by saying that I am a big supporter of Ripon's farmers markets, and I personally buy grass-fed beef and pork. I try and shop as farmers markets as much as I can, and so I make those choices. I've got to say I have the income to make those choices, because grass-fed beef and pork is not the cheapest way to buy those things. But I am also a grain farmer. My partner, right as we speak, is currently putting in the wheat crop. We crop on a farm south of Ararat. Now, most of what we grow is exported. So we grow canola and we grow wheat, largely. We grow a bit of barley and oats, and they're usually domestically used, but most of what we grow is exported. And Australia feeds 60 million people every year. So if we go to talk about changing what our agricultural system is, I think we need to take into account that we are feeding the world when we have the current one that we have. Now, as individuals, we can make choices about the kind of food we choose to personally eat. And I make a certain set of choices, but I don't foist them on others. So that would be my view.
Yeah, I just have a problem with whether it's our Prime Minister or yourself saying that I make choices to eat certain foods, and if I can run a marathon, you can run a marathon.
No.
And yet he's a Rhodes Scholar, and I would imagine that you're on slightly higher income, which you acknowledged at the start of what you said, but farmers markets and grain-fed organic beef are not going to solve the problem for the majority of people that you've already said are in low and middle income parts of Australia. The other evidence is, I mean, the evidence overwhelmingly says that voluntary targets from the industry don't work. That's from the WHO, the leading global technical body on health. Why is this? Because they're businesses, and anything that goes anywhere near their financial bottom line, they're not just it's not that they don't like to lose money, they're legally mandated only to return money and profit to their shareholders. That's the concept of a corporation. That's the fundamental concept of our economic model. But governments then need to step in and protect the health of individuals, and more than just the 1% who owns the shares in these large companies. And this is where the problem lies when we leave the changes to voluntary targets. And one example, I was reading an article just yesterday saying that, I mean, we were talking about prevention and the cost effectiveness of prevention. I already mentioned the SunSmart program. For every $1 we invest, we get 3.5 back. There was a study just recently published showing that salt reduction at a population level, which we've been able to make some inroads from the industry, but nowhere near where we need to be, because again, unless we mandate reductions in salt, the industry is not going to do it because they sell less products. We also know that the vast majority of our salt and our fat in our diet doesn't come from Joe or Sally putting it on their food as they eat their dinner. It comes built into the product when we buy it. But if we could actually get $20 million spent on salt reduction in Australia, the current science shows that we could save $1.5 billion in antihypertensive medications. They're the sorts of savings that we could actually see if our government started properly investing in prevention rather than just talking the talk.
Sorry, I just specifically went through a number of examples where I have advocated for funding for prevention and expressed my strong opposition to the cutting of the Healthy Together program by the federal government.
But in terms of intervention, where it's you're talking about sort of upstream and intervening, where the priority would be for morbidly obese people. You made an example where I would probably say, how would you intervene with regards to the public health crisis around childhood diabetes? And the position that you are in as a Member of Parliament, even if it is at a state level, allows you entry point to argue for a prioritisation of the budgets that are discussed at some level in your party. So we've heard that in 10 years we've got 10% of schools successful in being having a school kitchen garden, which is wonderful. At that rate, it would take a much longer time to get all of the schools in Australia. So would you undertake to advocate for a kitchen garden program in every school, for example, all around Australia within your party?
Ararat North is perhaps the most disadvantaged school I have in Ripon, and I have 44 schools, and I think it'd be really unlikely there'd be very many over the sort of 1,000 SES, the standard sort of average. So, but it is the most disadvantaged. And that school has prioritised being a member of the kitchen garden even when they can't afford it. So I'm actually a big fan of the kitchen garden program. I actually think it is the kind of spending that gets out results and is entirely congruent with the sort of things that I'd be saying. So yes.
Okay, Louise, can you bring Tony Abbott? Because we've been asked to put forward submissions by Christopher Pine, Josh Frydenberg and Susan Lay, all of whom want to fund every school in this country to do this program, and somebody in the background has said no. And I think I know who.
I've got to tell you, this may surprise you, I can't actually just ring Tony Abbott. But I can advocate, and I will advocate.
Jump in first if I can. I think the answer lies at local government at the moment, myself, because a local government and a local community will benefit from a vibrant local economy around food production and food consumption, and I mean real food, not rapid food. And I think that needs to come from the community, saying to local council, we want to support local producers, tell us who they are, A, And B, why can't we organise some sort of either local market or subsidy to help people afford their food? It's going to cut on their transport costs. I know I'm simplifying it, but I have to say there are projects like this happening in a lot of local governments around the world now, and you can do this here too. It can absolutely happen, and it's not hard to happen. I was fortunate to speak at a forum in Hamilton recently, and it was all about solving what they called the wicked witches of the West, which was the problems that they were facing, and food and ice were two of the big things on the top of the list. And we had producers in the room, people like Louise all sitting there, and what we discovered when we sat down to do workshops was that most of the producers didn't even know who each other were and didn't talk because they felt they were competing with each other. And it was, let's all come together. Let's take the focus for a minute on the fact, yes, we are feeding the rest of the world. Yes, it's now a global economy and it's not going to go back. We all know that. But there's still the opportunity for a local one too.
There was someone on the left. Yes.
I was just going to quickly say that there is, there was again a study, sorry I'm an academic, this is what I do, I talk about studies, but there was a study just that came out last week showing in fact that price isn't everything, but price is a major barrier. Education is the other, and we've talked a lot, so I completely support what was just said. I think education, and particularly in children, is absolutely key. If you don't know what an eggplant is, and but you know what an iPhone is, we've got a problem. But at the same time, price is a major issue. And as I said, in regional parts of Australia, the cost is 160%, even more than in metropolitan parts of Australia. And I think that could, that's something we can easily address. And I think the idea, I'm going to go really bold, but that's what we're here for. So I would like to see a tax on fast food that is used to pay for the Stephanie Alexander project to be in every school in Australia, and to be used to level that differentiation between what food that great producers like your husband produce in regional Australia produce, but to level that cost differentiation between rural and metropolitan Australia.
I think we've probably just got a semantics problem here, because when I was talking about targeting, I was talking to target to health people, not in any way to exclude or harm them. Statistically, rich people do not get that fat, notwithstanding Gina and Clive. Statistically, they don't. That's right.
Has got enough time, he says, to exercise, so he goes and has his tummy tuck and smokes his cigars. Come on.
I'm not going to talk about him. But I will stand by the view that we need to target people who need help. We need to help those who need help, not all of us. And so I understand that you're disagreeing. It is my core belief in the world that those of us who are more advantaged, who have more resources, should help those who have less.
I think that no one is immune to the advertising industry. Some of us might think we are, but no one is immune. As I said, McDonald's spends $50 million a year telling us how and what to eat. Nestle spends $120 million just in Australia telling Australians how and what to eat. How it's not the role, and I quote, I had an op-ed in the Age in January in a response to the Victorian Premier saying it's not the role of government to tell people how and what to eat. Well, if we've got industry spending $50 million and $100 million telling them how and what to eat, how is it not the role of the government to at least be levelling the playing field? I think that's absolutely outrageous. And, this is what we have elected parliamentarians for, to protect the entire population as a community. And I totally agree with you that they are using the most cutting-edge science. They're targeting specific parts of the community in an atrocious way. We all know about it, and something has to be done, and part of that is restrictions on marketing. We've seen that it works very well in tobacco. We've seen that it works quite well in alcohol, despite a strong alcohol industry here in Australia, and ironically us challenging Thailand when they tried to do what we did with tobacco packaging. That's another issue. But we need stronger restrictions on advertising. You know, kids shouldn't be able to just walk down the street and be bombarded on every corner with products that we know and they know and everyone knows cause disease.
I just want to add to that. I think that what's lacking in our country is political leadership. And the focus is wrong. The focus is on money and the fear. You know, fear is a weapon, as we've all seen, used incredibly well in politics over the last 5 years to make us make certain choices. And the fear around, you know, the size of our budget deficit and so on and so on. It's all about economic performance. There needs to be some government leadership around the wellbeing of people and a discussion about the fear there. And that discussion is not coming from government, it's coming from academics and people, you know, and it certainly won't come from industry either. No. And who's going to have the courage to take that leadership? I don't know. I really don't know the answer, but personally, if I was in power, I would ban political donations from corporates to government, because that is where yeah, that too. Yeah, absolutely. I mean, you know, absolutely. Give everybody the same allowance to advertise their policies and leave it at that, because that's where the influence happens.
And I should add, we shouldn't expect the industry to suddenly wake up tomorrow and stop advertising because it's the good thing to do. I mean, they are mandated to their shareholders by definition to sell more products. That equals consumption. It's the role of government to put barriers in place to protect us. Industry will keep doing as much as they can, and they should, to make as much money and drive as much consumption.
Could I just say I entirely agree that industry will do everything it can.
And you're against regulation.
And I'm about to give an example of where industry is in fact doing exactly what we're asking it to do. And it goes to an example we had earlier about Santa Claus was originally green and now he's in a red suit. Well, maybe he's about to go back into the green suit. Have you seen the new Coke? The one with stevia in it? And they've cut the calories there by 30% because their market is failing. People are not buying full-fat Coke anymore. Their diet drinks are still increasing, and we can have conversations about whether Diet Coke's the enemy. But in terms of sugar, all of that market segment is really falling because Australians no longer, you know, are drinking that, and so they are responding with stevia and, you know, Diet Coke and Coke Zero, you know, all of those. So similarly, in the US we've seen quite a lot of salt taken out of products compared to where they were. There's no question that these companies spend a huge amount of money creating hyper-palatable foods. That's what it's called. It's the sweet spot that makes us want more of them. There's no question about that. But it is also true that they are very driven by consumption patterns, and so Coke is reducing its full-fat products and increasing its low-calorie products because that's what people want.
First of all, don't be fooled by Coca-Cola, because there's actually, first of all, there's no evidence that their new Coca-Cola is any better, and there's good emerging evidence that they know, have known for a long time, that actually Diet Coke is just as effective in causing obesity as full-fat Coke. We can go into the science of that if you want to. The other is the idea of waiting for the industry to wake up and realise that they're losing market share. It sounds a lot to me like the tobacco industry and the 50 years it took to get there.